Good morning, friends. I am Dr. Naresh Kumar, Chief Cardiothoracic Surgeon at Yashoda Hospitals, Secunderabad. I would just like to today discuss about how do we manage the cardiovascular diseases during times of COVID times. So, coming to the heart problems. So, in a COVID patients, now generally they have commonly symptoms of fever and cough. Everyone is aware of that. Most of the general people also know about it. But a COVID patient, a patient who has got COVID infection, can also have heart symptoms. So, this is because the reaction which the virus causes inside the body generates some chemical mediators. So, these chemical mediators can go and affect the heart muscle. What happens is through the circulation, they go and affect the heart muscle. So this is the muscle of the heart. So through the blood vessels, these mediators go to the heart muscle and they can cause something called as myocarditis. So this myocarditis is a thing which can cause weakness of the heart and some infection and inflammation of the heart, which can persist for some weeks, maybe 2 weeks to 3 weeks, and then slowly, depending upon our treatment and supportive treatment, it could subside. Then there is another situation where patient already has a heart problem. Suppose the patient has a valve leakage, or there is earlier had a heart attack and his heart had become weak, which we call as heart failure or heart LV dysfunction. If he has a pre-existing heart problem, if that patient gets a COVID infection, his oxygen demand for the heart increases. Usually these people have very less reserve in their heart. So you can see that these patients who are already having heart problems, they cannot suddenly run, they cannot climb the steps fastly, because the reserve in their heart is low. So that is we call as myocardial oxygen demand. So with this infection, the myocardial oxygen demand increases and they become more breathless and they can become sick and they can land up in heart failure. Then there is another situation where it can present, COVID can present like a heart attack. Now if you see the arteries of the heart, if you see a cross section, it looks something like this. Almost, suppose this is a small area where there is a disease. And if it is a severe condition, it can be something like this, where it is totally blocked. Somewhere in between, most of the people we get like this, where they are already having some cholesterol deposition in their arteries. So now what happens is, due to the COVID infection, there is a possibility that there could be a rupture here in the surface of the cholesterol plaque. So once it ruptures, you can see here something, there is a clot formation. They can form a clot, and when this clot is formed, they can land up in symptoms of heart attack. And so any patients coming with symptoms of acute heart attack, we have to surely exclude that he has not contracted COVID from any of his people he has met or from his relations. And there is also a situation in which small children, which has recently been found out, especially in the United States, they get a thrombosis or clots in their arteries, that is their vessels of the hands and the legs, and they develop something called a syndrome called Kawasaki syndrome, which is also a very, very fatal disease. So we have to be aware of that if children develop such type of symptoms, and we have to work them up and see if they are having any COVID infection by doing the tests. Patients have the doubt. You see, when suppose he is there in the lockdown and suddenly he knows that he is a heart patient, or he may be in that range, like he is like 40, 50, or he is 50 plus or 60 plus even. He could suddenly get chest pain. Then he has a doubt whether I am really having a heart attack or is it due to something else. So the common COVID symptoms are like patient will usually get a sore throat and cough, which will be very dry. It will be like a dry cough without secreting any sputum, and fever. Cardiac symptoms are generally common is chest pain, which is due to heart attack, or if his heart is weak or there is a valve problem, we get breathlessness, that you are breathless. You become breathless, like you have been doing normal activity normally, but once you become breathless for normal activity or some little bit of exertion at home, it can be possible that you are due to cardiac problem. Cough sometimes is present also in patients with heart problems, and that is usually in the late stages. That is, once you have this breathlessness and all, and then they start developing cough, especially when the heart starts to fail, that is, heart starts to become weak. So there are other symptoms also which can happen, like in heart problems, that is swelling of the legs, swelling of the face, swelling of the abdomen. So in that way we need to differentiate, but it is very difficult for a normal person to differentiate. So he should always have a consultation with his friend who is a doctor, or can contact any of the hospitals, which are always, even the bigger hospitals or the corporate hospitals, which are open even during the COVID times. So what I would advise is, you see, once the patient gets a problem, like he gets a cough or he has the fear. So the fear, I would always say that you should not fear that, okay, I have become COVID, so there will be a lot of restrictions, people will put me in quarantine and all those. That is not it, because the treatment, if you get into a hospital and take supportive treatment, you can get free of COVID also if you are having. So, but heart problem is more dangerous. If you delay the heart problem, you can land up in very serious condition where you may not be able to save your life. So heart gives you very less time. If a heart attack is developing, and if there is a blockage developing in the artery, and if you don't open up the artery within 90 minutes, there is a high chances you can land up in death. So we would always suggest you that you get symptoms of chest pain or breathlessness, immediately you can come to the hospital, and there is a process by which you can we can investigate you immediately. Yes, so now heart problems can happen in two different ways. One is where you get something called an emergency, like you have got a sudden chest pain, or you are relatively normal, or you have been a heart patient and you suddenly got more breathless, or you got swelling in the legs and you are not able to do your activity when you are at home. So you can come to our hospital, and there is a cardiac emergency where the emergency patient, there is a separate emergency for COVID patients and a separate emergency for all other patients. So you need not worry that you will mix up with the patients who are having fever and cough. Your emergency will be separate. So once our cardiologists and the on-call doctors will see you, and immediately if they feel that it's an emergency, they would be admitting you into the CCU, and then what will happen is the required investigations, everything will be done, and there will be a screening test to know that there is a possibility that you can have along with the heart problem, you can have a COVID infection. So what we will do is, we do a few screening tests, like doing a CT scan of the lungs and doing a blood investigation. In general, we do not do the diagnostic test, like doing a swab for the COVID is not necessary unless you have very strong symptoms suggesting of that. We just do a screening test, and once we know that the screening test is negative, you will be admitted to our ICU, and the cardiologist will take you up for an angiogram, and if he feels that it is a angioplasty has to be done, that is opening up of the artery, then using a stent, it has to be done at the same time, because during these times when you know that there are situations where because of the lockdown you don't get proper transport, or you don't have availability of all the materials, if you are in the hospital and you know that you are having a heart problem, it is better you get it treated in the same sitting. Because suppose if you think, oh, I will go again and I will come back again, there is a possibility you can contract some COVID infection from somewhere else, and there may be delay to the treatment which is due to your heart. So we would always advise that once you have come to the hospital, if suppose there is a situation where all your arteries are blocked, and then you may be a candidate for bypass surgery, we would prepare you in a day or two, and then I can go ahead with bypass surgery also. And there is another situation where you may not be in an emergency situation. It is like you are having a slight chest pain, and you can always, in that situations, have a teleconference with the doctors at Yashoda Hospital, where all the cardiologists are available from morning to evening, and the emergency doctors are available throughout the day, and you can book an appointment with the cardiologist or with the cardiac surgeon, and cardiac surgeon will come directly to you. Can through your mobile phone, there are different apps through which the teleconference can be done, and when you have a discussion with the doctors, you always know, and we would be also able to assess you that whether your symptom needs to be treated immediately or can be delayed for some time. If it needs to be delayed, we can always give you an advice of what things are to be taken, and if we feel that you need to be evaluated, then we would always call you to the hospital and treat you in the OPD basis by doing all the investigations and other required things. So I would like to send a message to all patients who are having a suspicion that they could be suffering from cardiac problem, or if they have been earlier diagnosed as cardiac problem and have got some new symptoms, that they can always contact us through the teleconference app, or we have our emergency numbers, which if you ring them up, the emergency people will immediately respond to you and would be able to send you an ambulance to you, because at the earliest possible, because we have sufficient ambulances to carry the patients. In fact, we have a stroke clinic where there is a suspicion of you have got a stroke, be due to where you have got a paralysis stroke and all. Even the stroke clinic ambulance can come to you and give treatment there itself and get you to the hospital to do the initial treatment can be given there. Similarly, even our emergency ambulance, if they feel that your heart attack is going to be severe, they can even give your initial treatment, the first aid treatment inside the ambulance, and then get you to our hospital at the earliest possible. And our cardiologists and cardiac surgeons are available 24 hours, and we can attend to you without any wastage of time.